The fight against COVID has been immense, but it's setting back years of progress in the battle against other diseases.
The pandemic appears to be reversing the global gains we've made in the fight against HIV/AIDS, tuberculosis, malaria, malnutrition, and maternal and child mortality.
The crisis has seen a 25% decrease in diagnosis and treatment of TB in South Africa, Indonesia, and the Philippines. Health officials say it's time to fight tuberculosis again.
Well, the disease is usually transmitted person to person through the air and thrives in crowds. It primarily affects the lungs, but can also occur in any other organ. The World Health Organization says more than 10 million people develop tuberculosis every year. Deaths amount to about 1.5 million, and sadly that's often due to inadequate treatment. The problem at the moment is access to healthcare due to lockdowns, supply chain disruptions and rerouting of global health resources into COVID. Countries like Mexico are paying the price.
Here in Dr. Alberto Medina's private practice, they used to vaccinate babies against tuberculosis. But since September, new government rules means they haven't been able to get a new batch of BCG deliveries.
When you ask
the people who are supposed to deal with importing vaccines, they say a date hasn't been set yet. They told us it would arrive in January, but now some articles are saying they won't arrive until spring. There has been a public sector shortage of TB vaccines since the start of the year. In 2019, the shortfall was between 76% and 96%. The number of TB cases jumped from 17,000 to 45,000. Health specialists estimate that a lack of TB vaccines will affect between 200,000 and 300,000 newborns. Mexico isn't the only country where TB is still a health threat. Around 85% of all newly infected people live in Africa and Southeast Asia, with India, Indonesia and China particularly affected. In Mexico, the vaccine shortage is mostly down to the current government changing the system of how medicines are acquired and distributed. But vaccine shortages began under the previous government. This prompted the re-emergence of diseases such as measles, which went from being almost wiped out to 60 to 200 cases annually. This is according to a study by the Mexican Association of Vaccinology, which also reported complaints against the current shortage.
We've
had a shortage of some vaccines for the last few years. We're referring to vaccines like BCG, MMR, and the double vaccine. According to Dr. Medina, young families needn't lose hope because the tuberculosis vaccine can be administered during the entire first year after birth, not just the first 10 days. But the extended vaccine shortage continues to increase the overall public health risk.
Uzma Khan is Medical Director at IRD Global, an international health NGO active in Asia and Africa. What impact would you say COVID-19 has had on the diagnosis and treatment of TB?
So thank you, Ben, for having me here. It's been a journey for TB. It's been devastating 2020. We recently had data that came out and which showed that about 20% decline in TB diagnosis and treatment, which is huge for when you look at infectious disease, which has similar, as a respiratory pathogen just like COVID, but however, whose services were repurposed because of COVID. All the, infrastructure was started to get used before COVID as well, whether it's lab infrastructure, service delivery, community work, everything. So there has been a huge impact, and no doubt the lockdowns really affected TB service delivery. So it's been grave impact.
All you hear is COVID, 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 and a lot of young people, I guess, would never have even heard of TB. Would you say, though, that this setback for tuberculosis has been a fair trade-off for the inroads that have been made in the fight against COVID?
Not at all. I think it's not a fair trade-off at all. We're going to see further decline if we don't do something, something quickly, adapt as well with the new normal, whatever that is. And I do hope that we're going to realize how similar the two diseases are in terms of, some of the case finding as well as in other strategies, and adapt tools so that we can find synergies and optimize, use, things like contact tracing and other workforce as well, so that we can tackle both diseases.
So the threat to TB from COVID is real. What about opportunities? Are there any opportunities coming out of this, all of the research, all of the focus on the medical fields?
Absolutely. So there has been a grave impact, like I mentioned, but then there has been amazing collective knowledge that we have now for infectious diseases as a result of this global collaboration, which itself is an opportunity. Just learning that you can globally collaborate, whether it's for vaccine development and having something in a year, which certainly we haven't seen. And then there is the data that has come out that's awesome, the prevention knowledge and dissemination of prevention, the case finding strategies like using mobile health tools, drive-throughs. It's amazing to see all of these things. Also the screening, knowing that both diseases are so similar and you can screen it, like I mentioned earlier. So there's a lot of contact tracing, like I mentioned as well, not to forget, because there's so much that you can learn in terms of what to do and what not to do, which we couldn't do with TB because we didn't have a lot of resources.
Is there more that we can learn from COVID-19 to improve TB care as well?
Absolutely. I mean, service delivery methods, like we've been using telehealth for TB as well, but COVID also, showed us how to use some digital health platforms as well. And contextual, because one thing that's really important is to understand that countries have developed some of these tools, and it's not a global tool that is being standardized. So there are lots of things that one can adapt and use to local, context. So, yes.
Uzma, what inequities have been uncovered through this COVID-19 pandemic, would you say?
It's a lot of inequities. I mean, everywhere in infectious diseases, something that I have seen, and I keep on, as an advocate, a TB advocate, I keep on seeing is that TB it's an intimately a disease of, it's an intimate disease in terms of, related to poverty, and therefore it's all about human justice and ethics around how you treat people. With COVID, we've seen the same thing, although TB is a disease of the poor, but COVID affected everybody. And then you saw that, people who were at the most vulnerable suffered. And in terms of accessing care, having food support, they didn't know what social distancing means. And, how do you do that when you're living in crowded, homes?
So Uzma, is there a message you'd like to get across on this World TB Day, just in a sentence or two for us?
So I think the important message is to learn that the important learning is around social inequities. And I would like to talk about that because when we talk about scientists and researchers and people, we know everyone has the knowledge. Globally, we have a lot of tools, a collective wisdom. But what we don't have is we work in silos. And I wish we would collaborate on these kind of infectious diseases that are borderless. And whether it's in poor countries or whatever, it does help us reinforce the idea that it shouldn't take a pandemic for us to realize things. And we should get our collective wisdom on for science as well as become advocates for people.
Good point. Uzma Khan, Medical Director at IRD Global. Thank you very much for joining us today.
Thank you very much.
And time to hand you over to Derek Williams. Our science correspondent is still cooped up in his home study looking into your questions on COVID.
If one of the vaccines is less potent, could it help to take different kinds?
With vaccines still scarce and in high demand, it'll take a while for this to really become an issue. But let's take a theoretical approach for a minute. Say, from the perspective of next year, when, at least in some places, it's fair to expect that a wide range of vaccines will be available more or less on demand. But you got to look back to look forward. So a little history first. In the last few decades, the idea of mixing and matching vaccines to trigger a more powerful immune response has gained a lot of traction in the field of immunology. It's been explored in experimental HIV vaccines, for instance. The concept is known as heterologous prime boosting. And the aim is to capitalize on the fact that different vaccines can stimulate the immune system in different ways. So taking more than one kind could help strengthen immune memory by causing your body to make a wider variety of defensive cells against a disease. So mixing and matching vaccines might prove to be a good idea in the fight against COVID-19, but it could also potentially have harmful consequences. When it's been done in the past with other diseases, the mixing and matching mostly took place with vaccines that were pretty similar. But some of the COVID vaccines approved so far are based on very different platforms. So to rule out potential risks, we'll have to perform controlled testing with specific combinations of products. I think that we'll see a lot of trials like that in the long run. Some are happening already, but they'll take time, a lot of time. So for now, even in places where mixing and matching do happen, it's only in rare circumstances, and authorities still try to avoid it as much as possible.